Postpartum hemorrhage is one of the most serious risks after giving birth. Now, a simple tool is helping WakeMed doctors spot the warning signs sooner. WRAL health reporter Grace Haba shares how it's improving outcomes.
Moments after joy, emergencies can happen.
Hemorrhage is when you have bleeding that is beyond that expected normal amount.
In most cases, postpartum hemorrhages happen within 24 hours of delivery.
This is where we'll see this information.
Now, a simple tool that most patients don't even see is helping reduce negative outcomes at WakeMed before they ever happen.
When the patients come in, there is a questionnaire that the nurses complete based on their history.
Patients are then automatically categorized as either low, medium, or high risk of postpartum hemorrhage.
You'll see this is marked with a red,
matching color codes brightly displayed right on their chart.
It helps us just sort of have some of these anticipatory conversations. Sometimes we'll have specific tools or medications in the room. If patients are having a cesarean birth, we'll communicate that with our anesthesia team.
The toolkit by Epic is one of several things WakeMed has implemented in recent years to improve birth outcomes, and it's working. WakeMed data shows postpartum hemorrhage rates have dropped, affecting about 10% of births in 2021 to 7% last year.
I think as healthcare providers, we need to continue to educate ourselves.
Dr. Jenna Beckham says the effort is far from over, and tackling the other factors driving North Carolina's maternal mortality rates will take time and commitment.
There are a lot of racial disparities and a lot of our maternal morbidity sort of outcomes, and postpartum hemorrhage is certainly one of those. And utilizing things like this, where it is an objective risk screening tool, hopefully can mitigate any of those sort of underlying biases.
In Wake County, Grace Haba, WRAL News.
Beckham says the growing number of hospital closures, especially in rural areas, making matters worse by creating maternity care deserts. This is a growing issue that WRAL's Grace Haba has been covering. You can find more of those stories on our website, WRAL.com. Just look at the health tab.